I'm Johannes Siegrist. I'm a professor of medical sociology at the University of Düsseldorf. We're in a medical faculty, but I'm trained as sociologist. And my main research interest and area is the importance of work for health, for human health. And in particular, we focus on the fact that health is unequally distributed across societies. The lower your education is, your position in the working life is, the poorer is your health. So there is a gradient. And we want to explain this gradient. How come that working conditions contribute to this inequality in health? And this, let's say this question is of particular relevance in advanced societies in times of globalization, of economic globalization, because we have now new ways of stressful work. It's not only the physical hazards of work, but it's also the stressful work of uncertainty, of downsizing, of competition. And so we need to capture these aspects in a scientific way and to do population studies on the health effects of this kind of stressful work. That's basically my job. Well, there are underlying the empirical research are some normative concepts or some, let's say, policy implications. And importantly, at the core of my research is the notion of justice. How come that people are exposed to working conditions which are unfair, which hurt them, not only physically, but also emotionally, because of unfair conditions of their work. And specifically, we have developed a model in our working team which we called effort-reward imbalance, which means people put a lot of effort into work, but what they get out in terms of rewards, not only money, but also job security, promotion prospects, and recognition, non-material reward, that this doesn't fit. And this imbalance really gets under the skin and in the long run makes people sick. So the idea of fairness, of justice, to increase equality of opportunities, this is underlying our research. And that's why we go with our results, we go to the policy area and we tell them how they could improve working conditions to make life more equal, more flourishing, more just. For instance, in China, in different Asian countries, in Japan, in Latin America, in all these studies which were done now worldwide, we find this association between unfairness at work and increased risk, at least of mental health. I mean of mental disorders, mental diseases. So geography plays a role, the level of economic development plays a role. Culture is important because there are also resources which protect against these effects of stressful work. And for instance, very safe social networks or even belief systems in religions, but in particular good social integration can to some extent buffer the adverse effects at work, and also close family relationships. So if you have a private life, that to some extent can buffer these adverse conditions at work. So there is some diversity across populations. Well, I think the biggest problem studying the social environment and social determinants of health really is the damage which is produced by the current economy, clearly. I think we need to move toward an economy which is not fixed exclusively or primarily on individual profit maximization, but which looks for some fair distribution and for some solidarity between employers and employees. And so I think we need really rethinking the destructive components of the capitalist development. That's actually what I consider a major problem. Well, I'm working in the chapter 7, which is on work, but we have now reformulated the title actually, and it's Good Work for All question mark. And my contribution to that chapter is really to make a very strong case that you can develop and change working conditions such that the burden of disease can be reduced. And that's the main message, is really to employers, to trade unions, but also to governments and even to international bodies to try to transform the employment relationships and the working conditions such that they are more fair and they are health promoting in a way. That would be my contribution to IPSP.